This is Monica Beck simulation on patient Leo Halgren.
Okay, so we have Mr. Leo Halgren, a 55-year-old male patient of Dr. Charger. He is post-op day 3 of an AP resection of colon cancer. He had a colostomy placed, and he also had a lymph node dissection and a liver biopsy. He is not allergic to anything, and he is a full code. Neurologically, we are groggy, fully intact. Pupils are equal and reactive, moves all extremities well. He does have orders. We want to encourage him, ambulate, and get him out of the bed every shift.
Okay.
So we need to get him up to the chair at least once a shift.
Okay.
Let's see. He is on room air, satting 95%. We did have orders today to advance him to a full liquid diet. He's been doing that pretty well. We do have D5 half normal with 20 of potassium, going at 50. The PCA has been discontinued. We do have him on Norco, 1 tab, 5 milligrams every 6 hours PRN for pain. He's been tolerating that fine with the right forearm peripheral.
Okay.
So
Have you had much drainage out of
the colostomy,
Okay.
He did have an NG too, but that's been taken out. He didn't have.
Has he had any reports of any nausea, anything like that? Be able to give him anything? Okay. All right. Good. 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 All right. Let's see. We're gonna go on now and
Do your assessment.
do my assessment. Okay. Let me check your armband here. Mr. Allen, what is your date of birth?
12/1/57.
All right. My name is Miss Tidwell. I'm going to be your nurse for today, and I see in the report that you had some surgery. You had a colon resection done. You had a colostomy placed. How's that? How is it? How's it working? Are you having any issues with it? Are you having a lot of gas or having any?
Hard to breathe sometimes.
Okay. All right. Well, speaking of that, let's just go ahead and listen to your lungs, okay? All right. Sit for me. Take a deep breath. Okay.
Okay, his O2 stat is saying that he's 85%. So I'm gonna go ahead and put him on a nasal cannula.
The O2 stat is 85. Okay, we're going to go ahead and put some oxygen on him. Good. All right. Listen up here. Is either side, when you take a deep breath, are you having any discomfort? Does it hurt a little bit?
Yes.
It's hard for you to get that deep breath? Okay.
Yes.
All right. Okay. All right, let's get you hooked up. How often have you been using the incentive spirometer? Were you able to use it maybe 2 or 3 times during the night? I know it's ordered once an hour while you're awake, but if you were up at night, just to see if.
All right. Our BP is 154/92, and our heart rate is 102, and our respirations are 32, and our temp's 101. So probably need to go ahead and call the Dr. Charger and see what he wants us to do.
Sure. I probably should go ahead and listen to her belly as well. Make sure that because he's probably going to ask if we've got valve sounds, so I'm sure we did that before we measure. All right.
Ring, 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 ring.
This is Dr. Charger.
Hey, Dr. Charger, this is Jordan taking care of a patient, Leo Halgren. During our rounds this morning, we found that he's got a blood pressure of 154/92, heart rate of 102. Our temp has gone up to 101.1, and he's at 85 when we just put him on 6 liters nasal cannula.
Oh.
And our respiratory rate's 32.
Thank you. Okay, so let's go ahead and get a stat CBC, stat urine and sputum culture with sensitivity, stat chest x-ray, and ABGs. If you'll call those results to me. Blood cultures times 2. O2 is at what?
O2 is at 90 or at 6% or 6 liters.
Perfect. O2 is 6 liters. Continuous pulse oximetry, get an EKG now. Increases IV fluids to 125 milligrams per hour, and give them stat, Cipro, IV piggyback, 400 milligrams IV piggyback, and Q12 hours.
Okay, thank you, Dr. Charger.
Okay, you're welcome.
So technically, I should for correct S-bar, I should repeat that back to you.
Correct.
Okay, but you were talking way too fast for me to write all that down.
Okay, great job, guys. Thanks so much.
Is that all you want?
That's it.